The presumed purpose of the Senate Finance Healthcare Reform Plan and other plans circulating in Congress is twofold: to increase coverage and control costs, which begs the question, do they accomplish either goal? Joining us now is William Dow, Associate Professor of Health Economics at UC Berkeley. Professor Dow, welcome to Bloomberg News.
Thank you.
Does this accomplish either goal?
Well, the Congressional Budget Office has estimated that there would be about 29 million new people who would be covered by insurance by 2019 under this plan. However, it would leave another 25 million people still uninsured. So currently we have about 83% of non-immigrant population covered by insurance in this country, and that would go up to about 94%. So it is a great improvement in the uninsurance rate, but the 25 million remaining uninsured is a real concern. About a third of those are immigrant populations.
Then, Professor, of course, that also begs another question. The goal is universal health care. What about those who won't get coverage?
So that is certainly a real concern. There are a few countries in the world that truly do have universal health care coverage. There are many countries in the world that have universal systems for citizens but not for non-citizens, and others that have close to universal coverage. So 94% is getting pretty far along the way. Other bills that are being talked about in Congress could reduce uninsurance more, but at a much greater cost.
And, Professor, is the immigrant population question too much of a hot potato? I mean, it's not even in these proposals. Do you think there's any chance that it would be in the future?
Well, Governor Schwarzenegger in California took a very bold stance in 2007 during health care reform negotiations, and he said that all children should be covered by insurance, regardless of the decisions that their parents have made, regardless of immigration status. So that is not something that is being talked about explicitly, but it's certainly something that moderate Republicans have been willing to embrace, such as Governor Schwarzenegger, and is something that in the future could potentially be addressed.
The other thing that's addressed, it's been an issue of contention, is the public option. Does the public option help to control costs, in your view?
There is a hypothesis that it would. It is a great unknown. There are many unknown many mechanisms in the bill today which would have unknown effects on cost controls. We have many good ideas, and we're going to have many demonstration projects to see whether they would help. The same is true of the public option. We see in European countries, a number of European countries that have some type of public care have been able to control costs better than we have in the United States. Other countries, such as Switzerland, has received a lot of attention recently, does not have a public option, but what they have instead is an all-payer rate-setting mechanism in which they are able to control costs. It's essentially government price controls. So that's an alternative to a public option if one wants to try to control costs, but it's not terribly politically feasible at this point, although states such as Maryland have indeed embraced an all-payer rate setting for their hospital sector, and that appears to have lowered costs somewhat and lowered cost growth.
So it sounds like you're not terribly optimistic with the plan as it exists that it will significantly lower costs.
There are a lot of features that will help, but I think we're going to continue to have this discussion for many years about how we lower cost growth. And we expect costs to go up and up and up as we get richer. Richer countries will spend more on healthcare, and that's natural, but we still need to squeeze out the inefficient portions of healthcare. And so there are attempts to pay more on healthcare for value rather than volume, but the initial steps that are in this bill are not nearly enough to try to rein in that cost growth over time.
Professor William Dow of University of California at Berkeley, thanks very much for joining us.